Okay, so how do we define good quality care? Stage 1. It's challenging for practitioners and managers, and I think we just need to be mindful that it's challenging because care is complex, and models simplify how complex life is. If we look at an aspect of a service, there's so many facets. Last week, we looked at the dynamics between health professionals and the autonomy of health professionals, and then the different health professionals into play. We looked at the relationship between the clinicians and patients, and the agency relationship. But there are lots of other aspects as well that care is very complex. And so, we know that also there's a lot of scientific evidence that is now available, and there are really only marginal gains now. We know that the difference is when you do a cost-effectiveness analysis between treatment A and treatment P, it's getting smaller and smaller with 5% margins. Very little quantum leaps. I think the eras of when penicillin was discovered and everyone was getting cured from the infectious diseases has gone. Perhaps we wait for genomics, cancer treatments for the next quantum leap. But at the moment, we're really looking at a slightly better drug against an ever so slightly standard treatment. So really, it's getting harder to tell what the benefits, usefulness are. And also we have tons and tons of research, scientific research out every day. There's about I think rough scan 20,000 biomedical journals. And now there's also online publishing, so you can really have open access, which is great, but actually for us to be mindful that practitioners, clinicians, and managers have very little time to understand what is best practice. So we need summarized information in the form of guidelines. Japan have their own guidelines. Yeah, and your country, yes. So lots of different places have their own guidelines. So this is some pictures of guidelines from England. Lots already exist. And usually these are produced by governments, health professional associations, health insurance companies, international agencies, and also for different levels of treatment. So micro is a best drug to use to treat a disease, diabetes disease, what you should be having as a first-line treatment, second-line treatment, cancer therapy, what's the first cycle. So we're all familiar with the micro level of clinical practice, clinical guidelines. Then we have the meso level on how best to organize a service. So for example, for diabetic care, how do you organize that service? How do we provide better healthcare? And this is the level we're all working in, really. We're wanting to know how to run organized services to provide better care. But all of this needs to be scientific evidence combined with informed treatment. And it's for us to be mindful that science evidence alone doesn't form the everything of guidelines. It's a combination of context, cost, funding. In the last talk, you saw that 3 countries, UK, Canada, and the States, choose different ages and different populations to screen for AAA for their abdominal aortic aneurysms. They use the same scientific evidence, but what's differed is their informed judgment, the context, the consensus of experts. So some of us may have heard of Delphi measures, surveys, group techniques, consensus development. So different countries have different practices, and also a willingness to pay threshold. Some countries will spend this much and feel that that's worth the cost for, this is worth us spending this much resources on this. So guidelines are developed and slightly vary between different countries, and they're usually country specific. So in England, the National Institute of Health and Clinical Excellence, NICE, lovely acronym, NICE guidelines, so it's quite famous, probably if you've heard of it, produces NICE clinical guidelines, service pathways, and quality standards for lots of services. Also in England, professional bodies like the Royal College of Physicians, you might have seen there some of the guidelines as well, physicians and surgeons, specialist associations, etc., produce guidelines. So you might know internationally the WHO also has guidelines to support lower middle income countries. to help develop important clinical areas and pathways.